Hello, everyone. I'm Traci Arieli, end of life doula and founder of Comforting Closure. Welcome to the second part of our conversation on advanced directives. If you joined us last week, you'll remember we began the process of creating my advanced directive, and today we're going to finish that process. Maureen Kures from A Radiant Morning is back to continue walking me through the process, helping me clarify my values and wishes for the future. My husband, Oren, is still here with us, making this conversation even more meaningful. If you didn't catch part one, I encourage you to go back and listen. We laid the foundation for everything we'll be discussing today. Maureen, Oren, welcome back.
I think that the more we can think about living well and what's a good day, it'll help us make some of these decisions. And these are the questions you ask yourself every time you review your advanced directives. Is this still the same? Would I still be living well with the decisions I've made in this advanced directive? Would I still be able to have good days?
Well, for me, because I've had many surgeries, not being in pain is really important. There's a point where you're in so much pain that so I'd have to not be in pain. Um, there has to be, if I'm in bed and not able to get out of bed and not able to move, not able to eat because I'm so sick because I'm on all these painkillers. Um, and it's not, there has to be some kind of hope that I will get better, that this is just temporary. It might be a long temporary, but I will be able to get out of bed again. I will be able to eat on my own again. I will be able to live without pain. Those things are really, I can't imagine spending years in bed and not being able to get out. And having to be fed from a feeding tube for a year or 2 years. That to me, the quality of life, then it becomes insufferable, not only for me, but for the people who have to take care of me. And to me, it's unfair. And I know that Oren would take care of me no matter what, but I don't want him to live that way either.
Yeah, pretty much along the same lines. You want to live without suffering, and you want to thrive, not just survive. I mean, survival is you're taking in a breath, you're exhaling, your body's functioning, but that's the basics. That describes cellular organisms. You want to have a quality of life where you're looking forward to waking up, you're looking forward to going to sleep, you're looking forward to your next meal, and ideally doing activities that I know I'm not going to be doing the same activities at 90 that I will be doing today. It would be great if I could, but I know I'm going to slow down. But I don't want to be forced into going from 50 to 90 in an instant and not having the option to go back to an active life and just waiting for that day to come where, I'm no longer here.
I,
Oh, go ahead.
I'd like to add that I'll still be on my bike at 90, even if even if I have training wheels.
I love that. Now, I'm going to throw this out. What if you don't have the mental capacity to make choices for yourself? And there's certain choices that I'm thinking of. I know medical aid in dying is legal in California, and I don't know if you would ever choose that, but if you don't have the mental capacity, it's taken away. So I really want you to start thinking about, what if I had to live like this? Because we live until our very last breath. So what could be done to make it as good a day as possible?
So do you mean that because we didn't have mental capacity anymore,
We do not
that
have mental capacity to make decisions. You might still be able to communicate, but you're deemed not to have mental capacity to make decisions.
because of that, we can't do medical aid in dying because like Oren, could say, okay, we're going to do medical aid in dying because that's my decision and that's my autonomy and that is the law. Um, but I'm still stuck being in bed and a feeding tube. Well, then I would want Oren to do VSED, volunteering stopping of eating and drinking. And
Now, Oren would have the ability to stop your tube feedings and everything you've written in your
yeah.
advanced directives. Yeah, he would have the authority to do that. That's part of the advanced directive. And, and that's why I love the more we can have these conversations, the more hope there is to have the end of life, our final days and hours of living that we would wish for. It doesn't always come true 100% of the time. And so to think about, well, what if? What if that happened? Yes, we could remove the feeding tube. Yes, we can remove the ventilator. Yes, we can. And then, so think about what would be a good day in the circumstances that you're living through. Because, like I just said, we live till our last breath. We're not, they call it active dying, but really we're living till that last moment. So, um, those are things I want you to think about.
If I was to go today, if something was to happen to me, okay, if it was sudden, if I, God forbid, got into a cycling accident, or if I got, and I was brain dead, and I could not, yeah, give me, if there, you can give me a couple weeks or whatever to see if there's any change, a month maybe, but man, just put me out. I mean, just really, if there's no brain activity, and I know that you friends like Josh, who would talk to you about that. If there's just no hope, just take everything out. Just allow me to go peacefully. Now, if there was hope, and I'm up, but I'm in bed, and I'm in my 50s right now, or if I had cancer, and I think at one point, I think I would fight, fight, fight. Uh, but at one point, I would tell you, Oren, that just let me go because I'm ready. I would be vocal about it, and then you'd let me go. How about you, Oren? You think
It's
about today, not the future.
Yeah, for me, it's very much situational. If I had traumatic brain injury, I'm cognizant, but I'm not always lucid, and I can't tell if people around me are just there to serve me. I wake up, I do whatever I do, but I'm not taking into account that somebody like Traci might be spending her whole day just taking care of me. To me, that's surviving and not living. So that wouldn't be a good day. Now, if I'm cognizant enough to recognize that I have some capabilities left and I can take care of myself to a certain extent, and I can communicate that, that's a different story entirely. You have people with dementia who, they're in and out of consciousness. So that's a very different state, not consciousness. They're in and out of awareness, I guess you can call it. Um, and in the moments of clarity, you can ask your partner, am I being an undue burden? And if that's the case, I would communicate during those times what to do. But I'm assuming that I still have those cognitive faculties available to me. With a TBI, you might not have that. So, a good day for me is a day that I am not the ward of the state, the ward of my wife who has to take care of me, that I do have some autonomy.
So what I'm hearing is that I think you both saying this, that especially you are, if you knew who you were, where you were, who you were with, and can communicate and were relatively pain free. I'll do that because I'm for all for comfort too. That that would be okay. Not ideal, but okay. But it's when you cannot communicate and you don't know where you are and you don't know who you're with, that is not okay.
Correct.
Yes.
Yeah, I think that's really important for you guys to think about right now because you are younger. You really don't have any life limiting illnesses. So if something happened to you, it would be one of those what if scenarios. What if you were in that bike accident? What if you were in a car accident? What if you had a sudden heart attack, things like that. It's going to be more of the what if sudden stuff. So, and as you age, it will become more of the chronic and life limiting. So just as you do your annual reviews to keep that in mind. Is there anything else on this subject that you feel is important for Oren to know Traci, or Traci to know Oren?
In my perspective, the body is easier to heal than the mind. So if it's just a physical illness or limitation, whether temporary or permanent, that to me is very different from a mental issue where there isn't a strong chance that I'd come back. I know there have been cases where people get traumatic brain injury, they somewhat recover from it. If you can go on and have a normal life afterwards, close to normal, and not just, as I was mentioning before, not just surviving life, then I'm fine with people taking measures to keep me around. But it's situational. If you know that I'm not there and I'm not coming back, that the person that was me, then why stick around? I don't fear death. I fear the method of death, perhaps, but not death itself. I mean, there's a great line. There's a comedian, Ricky Gervais, who put it well. He said, "The party goes on. You're just not a part of it. You're no longer there." So I'm fine with the party going on without me.
I love what you just said. It's like we don't know because we've never experienced death before. So it's more of the fear of not knowing what to expect than the actual event itself.
Yeah, the way I like to believe it's going to be is you have no memory of what it's like when you're put under for a surgery and you come back and that time is just gone. That's it.
Right.
It's gone. It could have been a day, could have been an hour, could have been 10 minutes. You just don't know. And to me, that's what my impression of death is like. It's both infinite and instant. You're just not there.
Right.
The spark is out.
My beliefs are different, but that's okay.
What are your beliefs? Are you willing to share?
Yeah, I do believe in an afterlife. I do believe in, just because of the experiences I've seen of, doing my work. I do believe in an afterlife. And yeah. So.
But she's seen ghosts. I haven't. So it might have something to do with it.
You'll be cutting that out. You'll be removing that from this. That's something I want people to know.
I haven't seen ghosts, but I've experienced with especially one patient, a near-death experience, and they told me verbatim things that I had done while they were in this altered state. They weren't clinically dead. We were performing CPR, and he sat up in a corner and looked down, and he told me exactly what I had done during that time. And I'm like,
that's amazing.
I became a believer then. But jumping on to getting these decisions in order on this advanced directive, your California advanced directive. Do you have any questions about filling out the forms? We've talked a lot about whether to prolong life or not to prolong life. That's like one of the main questions on this form. And I always want to encourage you, the more you can write out, you can talk and share with Oren, or Oren you with Traci, but the more you can get it in writing, document exactly what you want, because this becomes the roadmap that you're going to give people. You're going to give your healthcare surrogates, you're going to give to your family members, anyone that matters to you, that you want to understand why you're making these decisions. So, I'm going to just show you this. I don't know if you can see it, but they only have a few lines. I always tell people, write out, say, see attachment, so that you can really explain what you would want and what you would not want. And this, doctors, they're trained to cure and to heal and to save. But to give them this, that's the roadmap you give them to follow. And it really is a great gift to them as much as it is to the person making the decisions on your behalf and for those that matter most to you that will be impacted by this. So, do you have any questions about any of this part of the document?
Are we gonna go through the parts of the questions that they ask?
Yeah, I think, and this pertains to the post. I do want to talk a little bit before we get into this, although I already started. The post form, provider order, sometimes they're called portable orders for life-sustaining treatment. They might be called most mobile orders for life-sustaining treatment. Um, a lot of the what you write out on this can be transferred to this post form. Those are really for people that have a serious life-limiting illness or are frail and elderly. They're not just for anyone, but it's important to know what they are. So,
And the
yeah,
doctor, that's not something that I can do, the doctor would be
the
filling that
doctor
out,
must, the
correct?
healthcare provider, it can be a doctor, a nurse practitioner, a PA, physician assistant. They're now allowed to sign the post forms, but you can take your advanced directives in and go over it with your healthcare provider. You guys aren't Medicare age yet, but Medicare does allow appointments just to discuss end of life planning, because when you have 15 minutes with your doctor, there's not ever time to discuss this. So I do highly encourage people that are older to take advantage of that. So the provider order for life sustaining treatment in California, you this is not the same in every state. I'm in Washington state, and a provider order for life sustaining treatment, the POLST, is adequate for emergency medical treatment. But in California, you must have a POLST form and a DNR form signed by the healthcare provider. And if something were to happen, we're just surmising that you have a life limiting illness and CPR was, or the emergency that paramedics were called, they would come in and you would give that to them. The person that was there with, say it's one of you, would give that to them saying, these are the wishes of Traci, these are the wishes of Oren. You're not there yet, but going over this. So one of them would be the choice to prolong life or not. Um, I don't want my life prolonged if I have an incurable and irreversible condition that will result in my death within a relatively short time. We've been talking about that. Or option two is I don't want it prolonged if I become unconscious to a reasonable degree of medical certainty. I will not regain consciousness, which is a lot of what you said, Oren, or that the likely risks and burdens of treatment would outweigh the expected benefits. So I think that with those, it's if I am put on life support, meaning the breathing tube and the ventilator or dialysis. A lot of people will live with dialysis for years and can have active lives, but as it goes on, it does become more and more life support. So think about would the treatment outweigh the expected benefits and what you are willing to accept. Do you have any questions about that?
Not on my end.
No. And that's so open because there's so you talk about, I mean, that can mean so many things. So it really, when we get there, we'd have to make that decision.
You would have to make that decision, and that's why the more conversations you can have around this. But when you're writing this down, and if you ever get to the point where you would have to do a pulse, but I just thought it was very interesting about the pulse and DNR must both be signed, because usually DNR is only a medical order in the hospital, and that the pulsed is what's followed outside of. So I thought that was interesting. And then the option B is I want my life prolonged as long as possible within the limits of generally accepted healthcare standards. Um, so we've already talked about that. So I think you guys have your decisions made. I think the next thing is relief from pain. You can state in here what pain level of pain is acceptable to you and not. I have worked with people that want to experience a very conscious end of life, and they're willing to tolerate the pain. I like comfort. So, and we each get to choose. And I do know that you can still get comfort care and be cognizant. When we slip more and more into coma, unresponsiveness, it's our body's natural shutting down. So it's not the pain medication that's doing this. And the other thing I want to remind you is that all death is not painful. If you have a painful diagnosis, then there's the risk of a painful death. If you don't have a painful diagnosis, most often you're not going to have a painful death. But do you guys have, Traci, you said you want comfort. So
Oh,
have you
yeah.
thought about what level of comfort you would want? What level of comfort care?
Oh, I want the max. You give me. Yeah,
That's the good stuff.
I'd like to be cognizant, but pain is. I think that, like, my belief is that if you're not in pain, it actually helps your body heal if you can heal. So just make me happy and comfortable. That's it. Oren,
What
how
if it
about
would?
you?
What if it were to hasten your death?
If I'm going to die, I'm going to die. I mean, it's not. I don't see that pain medication. If I'm that sick, that pain medication hastens my death. I'm on my way out.
Okay.
So,
I just have to remember one word: propofol. That's it.
Yeah, and people are afraid to give, especially morphine at the end of life. And as doulas, we don't advocate or not advocate for medical intervention, morphine does not automatically hasten death. It is an anti-anxiety. It relaxes everything so that people can breathe easier. So many areas of comfort. So, yeah, just to know that it won't always hasten death. So, what other wishes for your physical and mental care would you want?
can you give an example?
I think that would you want for your mental care? Often that's related to spirituality.
Mm.
If you have any spiritual practices, religious practices, universal practices, what would you want for that aspect, the mental? I think that could be music, environment, sound, um, meditation, fragrance, smell, what you would and wouldn't want. So I think from that mental health care, would you want meditation? Would you want someone to read to you? All of that, the more we can put down.
I would definitely want meditation. I like my, Ram Dass music, and I really like that type of spiritual music. And but I do not want a chaplain. I do not want, um, I'm much more Buddhist slash, what I like. And I want people visiting me, talking with me, laughing. Um, as far as, so music is really important to me. So all different types of music, but my favorites. And then you could have TV going on in the background. You know what I like. We laugh because when I go to sleep at night, if I can't, I put on like
True crime,
true crime.
documentaries, cold
That's
case
something to
files,
really
things like
relax
that.
you, right?
To each their own.
Yeah, I love it.
Smell baked goods are really, really good. Just that, baked goods. So, and I just, I love, I'd love to have people around me.
Yeah. Yeah, if I'm in a condition to be seen and to receive guests, for sure. My friend who passed away recently, he didn't want to see anybody. He was a very changed man after his surgery. He was partially paralyzed. He had a thoracotomy. So he was in no mood to see anybody.
Right.
It was only his daughter that came in at that point. So I had contact with her. So if I'm in the hospital and I know that my friends are going to pity me for the condition I'm in, I don't want to put them through that. I'd rather not. I think what my friend did was noble in that sense. You know, the last I saw of him, he was active and upright. So music, yeah, 80s music, that'll get me out of bed probably.
90s
And
too.
80s and 90s, yeah. You know the style that I like. So and I don't need the comfort of a religious chaplain or anything like that. Um, it's,
Well,
having somebody read to me is great.
Yep.
TV is fine. I just don't want to be parked in front of the TV and just live like that.
Books on tape.
Yeah.
I also think that yeah, I'm kind of opposite of you. I don't care if people see me at my worst because that's the reality of life. And the more we normalize that, you know, the more that people see it, it's just part of life. And yeah, you have to have a sense of humor about it also. So
I'll ask you if the time comes.
if the time comes.
Okay, so physical care would be more like physical touch, massage, someone rubbing your feet or rubbing your hands. I know my dad did not want his hands rubbed when he was dying, when he was last stage of living. He just expressed that, "I don't want my hands touched." Holding it was okay, but, do you have any thoughts on that? What sounds good right now that you're healthy and well? Would you want your feet rubbed?
I have dry skin and dry mouth. I need moisturizer. I need my lips to have moisturizer on them. I'm gonna probably be doing a lot of mouth breathing, so I'd like uh, my mouth inside to have liquid.
Mhm,
So that's really important because I get and eye
mhm.
drops because that's really important to me. I also I also want to be bathed. Uh, it's really important to me to be clean. And
Get the razor blade.
yeah, I need that's my one thing when we go backpacking out in the middle of nowhere. I always have a solar shower, the one of those bags, and I bring my razor. I need. I,
I
I
love
can't
that.
believe I'm telling people this on the air.
Well, I've told my boys, my 3 sons, "You have to make sure that my face has no facial hair," because I
Yes.
scare the old women with facial, that have the wiry hairs, and I'm like, "You cannot do that to me." So, I so now my 2 daughters-in-law are in on it too. So
Yeah.
those
Make sure
things
my
are but those
nails.
are physical care things that are important.
Yeah, nails are clipped. My diapers are changed. There, it's great.
Yes. Yeah.
How about you, hon?
Well, my ideal is to look like I did before I was in the hospital. So
Mhm.
whether that was, my hair was short, keep it short. Beard, it doesn't matter to me necessarily, but bathing, if that could be daily, fantastic. That would be great. If not, if it's a burden, then every other day. But I don't want to, just get into a state where I slowly just become one with the bed.
Right.
Yeah. And being moved around a lot so I don't get a lot of bed sores.
I really wanna encourage you to really take time to write that part out, because when that time of life comes and it's emotional and things are happening, to have that guide to go back to, that roadmap. "Oh, yeah, Tracy wanted to make sure she was bathed daily or that her skin was moisturized. I knew that's important, but I'm going to make sure I really highlight that. And or in that you are kept clean and not become one with the bed. Those are things that people forget as they're caught up in the caregiver's role, or even if you end up in a hospital setting. Those things are really important, and to maintain dignity as we go through this process. So the one lady with the little wiry chin hairs, she was on a ventilator and we were one of the nurses she asked me to help bathe her and we were changing her ventilator tape. But my friend said, would you like us to pluck those little chin hairs? And but I never would have thought of that. And I was a younger nurse then. I was probably in my early 30s and I didn't have chin hair or anything, but as we were doing it, she had two little tears like her come down. And my friend said, "Oh, are we hurting you?" And she shook her head no. And I said, "Are you just so happy?" And she shook her head yes. And that's the importance that we didn't realize. I never would have realized that. And now it's become important to me. I thought, wait, that's on my care list. I want to make sure that's part of my physical care. So the more we can think about that, and we might laugh about shaving our legs or chin hair or what all, but it's important to maintain that dignity. So the more you can write down. Um, the next part is on donation of your organs at the time of death. Do both of you want to donate your organs?
Definitely, even my brain, if they could use it. Everything, and the other parts, if they want to use my cadaver for medical students, I have no need of my body. And then
Go ahead.
if there's anything left, cremate me. That's, if there's anything left. If I'm a cadaver, there will be nothing left. But
yeah, same with me. I'm an organ donor. I prefer not to be cremated just because of the environmental impact. So any alternative natural to, whatever is left of my body, natural disposal is fine. I don't care if I have to go down the garbage disposal route.
No, there's actually terramation, and I'd prefer terramation with what's left also. I just know, I think with when they use your cadaver, do they embalm you?
They usually have to do something to preserve the body. So I don't think you would really have to check with the terramation facility. It depends on what's done. So I'm going to jump ahead a little bit. You both want to be organ donors, which is awesome. And it sounds like you want to donate your bodies to science. Have you both filled out that paperwork?
For the organ donors,
yes.
Not the brain donor. I haven't done the brain donor yet.
But doesn't the organ include the brain?
Well, I think
if you do the organ donor on the driver's license, does it include?
The brain would be more for study purposes. Like I know my son wants to donate his brain to Boston University's CTE study. So because of he had a bad concussion. But so there is something, the disposition of remains form that should be filled out. Now, I do want to know, you did say terramation after. It's been recently brought to my attention that there is not the need for cadavers that there used to be. And I was at a talk when the director of People's Memorial, they oversee the funeral industry. Well, they're part of the funeral industry here in Washington State. The director said only about 10% of body donation is being accepted. And I said, is that in Washington State or states, nationwide? He said nationwide, because medical schools are not using cadavers like they used to, because there's so much more sophisticated technology that they actually get better experience than cadavers. And so I would really like you to have a plan B.
Yep. There's water cremation here. So there's water cremation. Terramation, I think, would be the most natural thing that we want, because we'd be able to take that dirt and use it to plant a tree or do whatever.
Yeah.
And you're lucky in California. I know they don't have any terramation facilities in California yet, do they?
No, but I know people.
I know you know people. And but Washington State has facilities, and it's enough. So that's really good to know. And to get that disposition of remains form filled out and signed, and have your plan A is to be donated. But if that you are not accepted, just because they don't have a need, there's other medical reasons you cannot, they wouldn't accept your body. But right now it's there's not as much need. So then explain in part B what you would want.
Thank you.
Okay. The other thing I wanted to talk about is the HIPAA, the Health Insurance Privacy Act. And that's important to have that HIPAA document. Now, Oren and Traci, you're each other's next of kin and your listed decision maker. So they would automatically talk to you. And if there's anyone else you would like healthcare providers to talk to, it's best practice to have that HIPAA form filled out and given to the hospital.
Thank you.
Any other questions about going through this advanced directive? I know we're doing it fast.
Yeah, CPR.
CPR, I love to talk about CPR.
I know Oren knows I love to talk about it too.
Yes, yeah.
Crack me like a soft shell
Great.
crab.
Thank you for bringing up CPR. CPR was brought into existence. They started performing CPR on people. It's best for people that are healthy and have an immediate need. I think that even if you're not football fans, it was all over the news a few years ago, a football player, an NFL player that was hit right at the time of the conduction cycle of the heart. He went into full cardiac arrest right there on the field. He was young, he was healthy, he had all the emergency medical devices available to him, and he did well and he recovered. But that's why I got my little handy dandy CPR guide out. I think people don't realize the impact of CPR. It's not as effective if you're frail and elderly or if you have life-limiting illnesses. And there's a really good CPR guide that I am happy to share with you. I don't know if you have this CPR guide, Traci. Yeah, I'll send it to you and you can put it. It really it's perfect if there's hope of prolonging or to getting life back to how it was. And I've seen it successful over and over again. And I've also seen it prolong life without quality. So some of the things, like I said, it's best if you're healthy and it started right after your heart stops. We have about 4 minutes of perfusion in our bodies, 4 minutes that we can live without our heart beating before serious, significant brain trauma occurs, lack of oxygen. As I said, it's less successful if you're weak, elderly, or have a chronic illness. So really, it's so important to talk to your healthcare provider about that. And this is what really surprised me. We see CPR on TV, and I think that there's been studies done, and it's like 70 some odd percent. I want to say 76% of people at the beginning of the TV show, they're rushed in, CPR, having full blown CPR. And by the end of the half an hour or hour medical show, they're walking out fully recovered. National studies show that 18 to 30% of people who receive CPR in a hospital survive and are discharged. So we're not even talking about anyone outside of a hospital. Usually outside of a hospital, there's less, the number would be much lower. 28% of those who do survive have significant neurological disability. So only 18 to 30% survive, and then 28% have significant neurological disability. And I think people don't realize that CPR, if it is not done effectively, and even if it is done effectively, sometimes there still is impairment. And 2% of nursing home patients that have CPR survive.
Okay. So we're talking about age there also.
We're talking
age.
about age.
Yeah.
But with the hospital, that's from birth till end of life. the hospital studies. That's not just for old people. So young people do die even if they have CPR. One of the things that people don't realize, that you have to do very deep compressions to have it be effective. That means they're pushing on your chest at least an inch down to really get, that heart pumping so it can perfuse the oxygen, get it through the lungs and perfuse your brain. Oftentimes, there's fractured ribs and fractured bones because of CPR. So if you do survive, if I survived and was back to my current state and I had some broken ribs, well, okay, I could put up with the pain, but that's not always what happens, especially depending on the situation. Um, and brain damage because of lack of oxygen. So I think people really need to think about, where am I at in life? Where, if this happened, would I want CPR? And that goes back to that pulse form. That goes back to that first question, what would you want done? Um, so I want to have CPR attempted if my heart stops and I stop breathing. Or maybe I want to have CPR if my heart stops or my breathing stops, unless I have an injury that I would not benefit from this and that I can't be cured if I have little chance of survival. So, really, to talk these things out and really look at all the facts of CPR rather than just say, I had a 94-year-old say, of course I want CPR. I said, wonderful. Well, let's talk about this. Let's really talk about this. And, I whipped out this little CPR guide and we really talked through the impacts on a frail elderly body.
Yeah, it's like my father who's in his 80s and very claustrophobic, really claustrophobic. Couldn't even be in the hospital room. And the doctor walked in and said, "Mr. Stahl, I need to ask you, do you want CPR?" And my dad was like, "Yeah, you keep doing it." I'm like, "Whoa, whoa, whoa, doctor. When you do CPR, are you going to break his sternum?" And the doctor said, "Yeah, most likely." "Are you going to have to put him on a ventilator?" Which my father said he does not want to be put on a ventilator. He's claustrophobic. There's just no way. And the doctor said, "Yeah, we would have to put you on a ventilator." And that's a very different conversation than just saying, "Do you want CPR?"
Right. And I think that that's why it's so important, and that's another one at your annual review to address, am I still in a state of health where I would want CPR? Or has 20 years passed since I first started thinking about this, and now I'm in my late 70s, and I have osteoporosis in my spine, and I have, chronic obstructive pulmonary disease, and would CPR make my life better, or would it just prolong and make it worse? So,
Right now, I think I could handle CPR, honey.
Yeah, it's age
Yeah.
dependent,
yeah,
physical condition dependent.
Yeah.
yeah.
Okay.
Okay, and then, the last thing, execution of this, your whole advanced directive, the choosing your decision makers, getting that all done, writing out all your decisions and really writing them, not just checking the box or writing a sentence or two. I just want to keep stressing this is your roadmap you're giving each other, you're giving your healthcare provider, and you're giving those that matter most to you. Because even though Oren might be your decision maker, your family might rise up and say, and I'm not saying they will, but no, we want everything done. Why? And they could really fight Oren on and make it unpleasant for them. So I always say, get it done. Then in California, it is the same. It's the same in most states, but really check state specific. Witnessed by two people. It doesn't even have to be anyone you know, as long as they're willing, but it cannot be someone that would be, it cannot be your decision maker. It cannot be your healthcare provider. It cannot be, if you're in a community, an assisted living community, it cannot be anyone there. So you want to really make sure that you have someone. It's two witnessed by two people or notarized by a notary in your state, and that makes it become a legally binding document. Now, if you were to change this, you just would write void or invalid across it and go with one that is the most current. And the thing is, people will not always do this part to get it witnessed or notarized. And it's really just an expression of your wishes at that time. So that is really important. And then make copies, 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 and give them to everyone. And I really love to have families get together and talk about it, because it's great if Oren knows, or and it's great if Traci knows, but if no one else that will be impacted in your close inner circle, and it could be family, it could be those that matter most to you, which are extended, it's your family of choice, or your healthcare provider. I froze there for a minute. But if the more you can talk about it, the more you can share with them, the more likely you're going to have the outcome you want. And it will also give them the direction they need to take. So get it witnessed or notarized, make copies, 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 and pass it around.
And
And
I
then
always
talk
like,
about it.
yeah, I always like to have the conversation also with the family, with my family of, here are my healthcare proxies. They'll be the only people making my decisions for me. No one else.
Right. But by having these conversations, it gives your family, they don't have to agree. As I said, they don't have to agree with your decisions. But so often it helps the family from becoming fractured. And hearing from us. And what's so nice today is that we have these mobile devices that we can just sit there and record. Hey, I want you to know I have this healthcare advanced directive, and I've written out everything I want, including organ donation, how I want my body disposed of, and what I would want in between. And I just want you to know that these are my wishes, and I want you to honor them, and this is why. Or it might be you might choose a second healthcare proxy, and someone else might be upset that they weren't chosen. I've had that happen, and explain why you chose that person and give someone else a task to do. So it might be that you chose one brother and not the other, and he's like, "Hey, why not me?" Well, you can have him do another task, like contact people. There's so many things that you can do, and it goes so much deeper than just the medical advanced directive, but this is such a great start, and just share
Well,
it.
thank you. Thank you so much, Maureen, for being here today and for leading this conversation. Before we go, could you share with our listeners how they can learn more about you and your work?
I would love to share that. So, my business is called Radiant Mourning, and like in grieving, not early dawn of day, but radiantmourning.com. And that's how they can reach me, or gentlepassagedoulacollective.com. I also am an end of life doula that we do doula training and education.
Wonderful. Thank you. Folks, as we wrap up today's episode, I want to leave you with something to reflect on. Conversations about our wishes and values, especially around healthcare decisions, are emotionally overwhelming. Still, they are a gift we give to those we love. Making your wishes known helps your loved ones to advocate for you with confidence and grace. Thank you for joining us. If you have any questions, please comment below or contact me directly. If you found this conversation to be helpful, please like, share, comment, and subscribe. This is Traci Arieli from Comforting Closure, wishing you peace and comfort in your journey. Until next time, take care.